Hi, my name is Bree. I'm going to be your nurse today. Is it okay if I do a head-to-toe assessment on you?
Yes.
Okay, can you tell me if you have any allergies?
No allergies.
Can you tell me your name and date of birth?
First name Lawrence, last name Moore, April 1st, 1994. That's my date of birth.
It's concurrent with the wristband. I'm going to put on gloves, disinfect the equipment that I'm using. I'm going to doff the gloves and throw the disinfectant wipe and the gloves away. I'm going to raise the bed to a working level. I'm going to then assess your pain. Are you in any pain at this time?
A little bit of pain.
Can you rate your pain on a scale of 0 to 10, 10 being the absolute worst pain you've ever been in?
5.
5. Okay. So does that pain come and go, or is it constant?
It's constant.
Constant. Does anything make that pain better or worse?
Tylenol.
Tylenol. Okay. Can you describe the pain? Is it burning, aching, stabbing?
Aching.
Aching. Okay. Does the pain stay in one location, or does it travel?
It stays in one location.
Okay. So I'm going to look now at your general appearance, which it seems very clean. Your clothes are well groomed. You look very good. Your mood is pretty concurrent with your situation. Your expression is irritated but okay. Your speech is clear and not hard to understand. Can you tell me your name?
My name is Lawrence Moore.
Can you tell me where you are?
I'm at a hospital.
Can you tell me what year it is?
Yep, 2024.
Patient appears to be A&O times 4. There is no assist devices used, no hearing aids present. Now we're going to move on to vital signs, which appear to be within normal limits. Next, I'm going to look at the skin and nails. His skin seems to be clean, dry, and intact. I'm going to pinch the top of your hand just to check for skin turgor. Skin turgor within normal limits. Now I'm going to look at his hands. His nails are clean, round, and symmetric. I'm going to now push on the top of your nail to check for cap refill. Cap refill is within 3 seconds. Next, we're going to move on to head, face, and neck. I'm going to perform hand hygiene and put on clean gloves. At this time, I'm looking for symmetry. Your face is symmetric. There's no facial drooping. I'm going to inspect the top of your head for any lesions, infestations, or lumps or bumps. I have gloves on at this time. No lesions or infestations present. I'm going to now look at your trachea. Trachea is midline, no deviations. I'm going to now use a Q-tip to check for cranial nerve number 5, just to brush it along. And I can also hold on to this and have you clench. Cranial nerve number 5 is intact. I'm going to have you scrunch your face. I'm going to have you puff out your cheeks. I'm going to have you smile really big. And I'm going to have you frown. Cranial nerve number 7 is intact. Next, I'm going to check cranial nerve number 11. Shrug your shoulders. I'm going to have you push against my hand. Turn your face towards this hand. Cranial nerve number 11 is intact. Next, we're going to move on to the eyes. The appearance of the eyes are no redness, swelling, or drainage present. I'm going to use, with gloves still currently on, pull down the conjunctiva. Conjunctiva is pink and moist. Sclera is white. I'm next going to use my pen light to check for pupil reaction. Pupils are within normal limits. They are 3 millimeters and reactive. Next, I'm going to do cranial nerve number 3. I'm going to check for the cat whiskers. Just using, again, just a Q-tip. I'm going to have you follow the Q-tip. Okay, cranial nerves number 4, 3, and 6 are intact. His pupils are clear. Pupils are equal, round, and reactive and accommodating to light. Next, I'm going to check his ears. We're going to look at the exterior auditory meatus. There is no redness, swelling, or drainage when I palpate, or is it tender when I touch?
No, it's not tender.
Okay. So next, I'm going to stay behind the patient, and I'm going to check for cranial nerve number 8 by doing the whisper test. I'm going to have you hold one ear. close one ear, so I'm gonna whisper. I'm gonna have you repeat, and one ear at a time. ABC. And then cranial nerve number 8 is intact. Next, we're going to check on nose. Nose is symmetric. There's no redness, drainage, or swelling to the exterior aspects. I'm going to have you hold one side of your nose and sniff, and hold the other side and sniff. Patency is bilateral. Next, we're going to move to mouth and throat. I'm going to have you smile. Gums, lips, and are moist and pink. I'm going to move to this side, sorry. Moist and pink. We're going to have you, I'm going to have you stick out your tongue. I'm going to use a Q-tip again, and look at have you stick out your tongue. At this point, I would normally check gag reflex, and I'm going to have you move your tongue side to side, up and down. Okay, that works good. And I'm going to have you stick out your tongue and say ah. At this time, cranial nerves number 9, 10, and 12 are intact. Next, I'm going to move to the respiratory system. At this time, I'm going to perform hand hygiene. I'm going to put on clean gloves. I have noticed that the patient is not using accessory muscles to breathe. So now I'm going to listen to his lungs. At this time, I'm going to listen to your lungs. Please just breathe normal. Don't be uncomfortable. We're going to do the right upper lobe, left upper lobe, right middle lobe, left upper lobe, right lower lobe, left lower lobe. Next, I'm going to move to your back. If you could sit up just a little bit. Right upper lobe, left upper lobe, right middle lobe, left upper lobe, left lower lobe, right lower lobe. There is no wheezing or crackles present. Next, I'm going to then move on to the cardiovascular. I'm performing hand hygiene again. I'm putting on clean gloves. I am going to, at this time, I'm going to listen to your, I'm going to palpate your carotid arteries one at a time, making sure that I don't press on both and cut off circulation. Present on both sides. Next, we're going to listen to the pulses using the diaphragm of my stethoscope. This is the aortic, which is the second intercostal space on the right side of the sternal border. The pulmonic is the second intercostal space on the left side of the sternal border. The Erb's point is the third intercostal space on the left side of the sternal border. The tricuspid, which is the fourth intercostal space on the left side of the sternal border. The mitral valve, which is the fifth intercostal space, mid-clavicular line on the left side of the sternal border. And you have and then I'm going to switch and do the bell of the stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and your mitral. Now I'm going to go and I'm going to feel both sides radial pulses at the same time to make sure they're both bilaterally strength and present. Radial pulses are present on both sides. At this time, I'm going to again perform hand hygiene. Now I'm going to move on to the gastrointestinal area. Looking at his stomach, it is symmetric. And if I'm going to look across, there is no distension noted. It is contoured perfectly. I'm going to now listen to bowel sounds, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And when you listen to bowel sounds, you make sure that you're listening for at least 5 minutes each quadrant to make sure that bowel sounds are present.
Go, stop.
Next, I'm going to move on to palpate the gastrointestinal, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No